Do you suffer from constantly watery, itchy eyes? A nose that won't stop running? Or do you suffer from itchy welts on your skin or swelling on your face? Then you're in the right place on this video, because today we're talking about cetirizine. What is cetirizine? Cetirizine is a medicine used to treat allergies, for example hay fever, that is allergic rhinitis or rhinoconjuncitivits. Hay fever is the most common form of allergy. Typical symptoms include runny nose, swelling of the mucous membranes, and burning and watery eyes. Cetirizine is also effective against hives and angioedema, which can also be caused by an allergic reaction and manifests itself as itching, wheals, and redness of the skin or swelling of the face. How does cetirizine work? Cetirizine is a so-called H1 antihistamine. These are active substances that inhibit the effect of a messenger substance called histamine in the body. Histamine leads to an inflammatory reaction in the tissue and is released from so-called mast cells in the skin during various allergic reactions. Now, cetirizine comes into play because the active ingredient blocks the histamine docking sites, also called receptors. 4 different types of receptors are now known, with cetirizine specifically inhibiting histamine 1 receptors. The group of antihistamine also includes, for example, the active ingredients loratadine or fexofenadine. What should be considered when using it? Film-coated tablets with dosages of 10 mg are available for adults and children 6 years and older. Cetirizine juice can be taken by adults or children 2 years and older. Cetirizine works fairly quickly, with 10 to 30 minutes. It also has long duration of action of 24 hours, so a single application, preferably in the evening, is usually enough. You can take cetirizine with or without meal, but with a glass of water and unchewed. Possibly, if you suffer from urticaria, your doctor may even recommend you take up to 4 tablets of cetirizine. Speaking of which, if you suffer from allergy symptoms, be sure to check out our video on Quercetin, a substance that acts as a natural histamine inhibitor. Does cetirizine cause side effects? Pharmaceutical manufacturers must list all known side effects in the package insert of a drug. Therefore, this section is often very long and does not inspire confidence. But many of the stated side effects are very seldom. Side effects classified as common may include mild drowsiness, dizziness, headache, and dry mouth. As already described, cetirizine belongs to the H1 antihistamines. These can be further divided into older and newer ones. The newer antihistamines hardly reach the brain and usually do not make you tired, in contrast to the older preparations. If you still feel some tiredness, you can either take cetirizine in the evening or replace it with another active ingredient, such as loratadine. Occasionally, patients taking cetirizine may also experience diarrhea, skin rash, and itching. Some patients also suffer from increased activity or restlessness. Can you drink alcohol and take cetirizine? Cetirizine does not increase the effect of alcohol, but in sensitive people, simultaneous use can negatively affect attention. Who should not use cetirizine? Because cetirizine is excreted primarily by the kidneys, patients with severe kidney damage should not take it. If you have problems urinating, you should take cetirizine with caution, because the problem may worsen under these circumstances. People who are prone to seizures should use cetirizine only after consulting the doctor. What are alternatives to cetirizine? There are other active substances from the group of antihistamines. For example, you can take loratadine. Loratadine has the advantage that it hardly triggers fatigue, but it has a weaker effect. Desloratadine is another alternative that is even stronger than cetirizine, but in many countries, such as the USA, the active ingredient is only available on a prescription basis. We hope you enjoyed our video. Leave us a like and don't forget to subscribe to the channel. See you in the next video.